This is the Emergency Medical Minute, sponsored by Mile High Ambulance. The Emergency Medical Minute is excited to announce that we are now offering AMA PRA Category 1 credits. This is accessible through our online course modules that can be accessed at www.emergencymedicalminute.org/CME-courses, or simply by clicking on the link in our show notes and creating an account.
I was going to do a brief medical minute on something that I think is very basic, but is, I think, also very fundamental, but really important to review, and that is just basic pulse oximetry. And so when thinking about blood and the amount of oxygen dissolved in blood, almost all of it is bound to hemoglobin, right? So that complex is oxyhemoglobin. A very, very small portion of it is dissolved in the plasma, and that's like almost like trivial. We don't really care too much about that. Like 99+% of it is oxygen bound to hemoglobin. Now, when we take a pulse oximeter, we put on a finger, there's like two wavelengths of light that are emitted, and that is sending through the finger or the ear or whatever, and the detector on the other side is measuring how much of it is getting absorbed. And then there's a calculation that goes in place and that figures out, okay, how much of it is basically, saturated. So the goal is like 100%, right? We all know that. Here at our elevation, it should be like 92, 94%. Now, the question I want to ask you guys is, how do you know if it's, if you're on the venous side, really, or the arterial side? Because you've got arteries and veins in your fingers. We care about the arterial side. How do you know, what's arterial? Well, you know because of pulsation, because that's why it's called pulse oximetry. So as the heart beats, there's a wave of blood that goes through, and it measures the increase in absorption with each of those pulses, and that's how you know what's arterial oxygen versus venous oxygen. So knowing that, then that matters for cases like someone who, one, has poor perfusion peripherally. They're not going to have good pulsation, so you don't get the pleth. Someone who has an LVAD, they're going to have a steady flow, so they don't get pulsation, so they have very unreliable pleths, so they have very unreliable pulse ox readings. And then one useful troubleshooting tip I know is if someone has thick nails or paint on it, what would you do? You can also just turn it sideways. It'll do the exact same thing. So don't spend time scraping off someone's nail or nail polish or whatever. Just you can turn the pulse ox sideways and it'll work the exact same. So just a couple little refreshers on pulse ox, how it works and things like that. One other thing I think that is useful with it is for cases where patients, you're trying to see if you have mechanical capture. Someone has a transvenous pacer or a pacer on. We don't care about the electrical capture. We care about blood going to the body. And so the pulse ox will tell you that, right? You have a electrical wave of 80 on the monitor, but only 40 as your pulse ox. You don't have capture, right? Because we're not getting 80 beats per minute to the fingertip. So pulse ox I think is super useful, is easy to kind of forget how it works, and if you know how it works, then you can troubleshoot and make some good calls off of it. So that was all. Just a quick review of something pretty basic.
Thank you.
Yeah. Let's have a good shift.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.